It's January 31st, and I'm in Costa Rica, and my surgery's in like 10 minutes. And things are going well. I had my first appointment this morning, and, well, my first appointment yesterday, and I got good news. One less implant. One of my teeth is healthy. So I have a miracle there, and no hole in my sinus, so no sinus lift, so there's another miracle. And really grateful for all of the love and the support and the prayers and the notes and well wishes I'm receiving. So it's time to go in and let God take all of this stuff that isn't in harmony and that I don't need out of my mouth and head and sinus. And stay tuned. Mwah!
So on my surgery day, I didn't have a lot of photography or videos after that one before I went into the clinic. But when I went into the clinic, I had an IV with the vitamin C and B vitamins and the bicarbonate and potentially some anti-inflammatory and the antibiotics. So I'm allergic to penicillin, so they offered an alternative that I could do in an IV since I was already doing extra high dose vitamin C IVs. And so I ended up getting a port on my arm so they didn't have to stick me every day. And then it was actually kind of on my wrist. And I had 11 days in a row. So that was just, the surgery was day 2 there. And that continued for 11 days. And I believe the antibiotics in the IV might have been 5 days instead of oral. So we did the IVs, and then they take the blood to create the platelet-rich fibrinogen membranes that are really the gold standard for dental bone restoration. So they use that with the bone matrix, and they put the membranes in from your own blood, and that helps your bones regenerate. So the surgery was under anesthesia. I remember going out pretty quickly once they got me in the chair. And the schedule was estimating a 2-hour surgery. However, it was about 4 hours, partially because the cavitations were very serious with a lot of infection. And also my surgeon's a facial maxillary surgeon, so he went in above my teeth line up here and cut a hole to go in to the sinus and remove. It was like that big, like think of a cocktail onion, a cyst full of fluid and infection that had been in my sinus that you could see in the CT. So he was fishing out, with suction and trying to pull that out. And he said it took him like over a half hour just to get that done. So he also took out the titanium implant here, which is amazing because the titanium implants don't integrate as strongly to the bone as a ceramic implant. But the good news is when you're having them removed, at least because I saw videos of this the next day, it seemed like he was just able to screw it out and it was not traumatic at all. And then he just cleaned it out and replaced it with the ceramic implant. So he did also do some bone, a technique above these implants with some bone material. He told me that he thought he was going to need to do an actual plate with bone and screw it into there. And then luckily after the surgery, he said it wasn't it didn't need to do that. So he did a milder, less invasive technique. And part of what had happened is in my dental history is this tooth that I had the titanium implant since I think it was 2015. It was an internal resorption on that tooth. So what happened was I went in and I felt like there was a burr on the back of that tooth. So I went to the dentist to see what was going on. And it was actually a little hole in the back of the tooth. And they explained to me that it had resorbed. So it was like my body absorbed the inside live part of the tooth. It just was hollow, which is really crazy. So it was sort of shocking because I was going and thinking I just had chipped something. And then it was basically, okay, we're pulling this and you're going to need an implant. And it was, an upper front tooth. So there was a lot of surprise with that experience. And unfortunately, what happened is when that dentist tried to pull that tooth, they broke off the tooth at the gum line and broke the bone, jawbone broke. So that turned into a year waiting for the bone to heal with a flipper and a fake. Actually, we used my old tooth, part of it, in there for most of the time. And then finally, after waiting a long time, then having the titanium implant. That was not a good experience either. I never went back to that dentist after that implant was placed. It was very traumatic how that all went down. Um, so, but luckily it wasn't hard at all to have it removed and to have it replaced with the ceramic implant. But that bone ridge had been broken before, which is why my surgeon was considering shoring up the bone with a different technique and envelope technique, I think he said it is. So they put bone material just tucked in under the gum in that area to help it grow. So they took out all of the 5 root canals and the titanium implant, and they placed 7 ceramic SDS, which are the Swiss dental system implants, zirconia. And one, like I said, was a bridge that just had, the tooth wasn't there. So I'm putting these viewer warnings because I've been told that my YouTube channel could be taken down or have a strike against it if I show anything too graphic. So even if it's mildly graphic, I'm going to put a viewer warning on it. But I have footage of video of my surgery, but I don't think I can show almost any of it. So in this video, there's a photo of me without anything, like with my mouth as open as they pried it open and hold it open, but there wasn't any work done yet. So it was the setting the scene of everything ready for the surgery, and I was unconscious, but there wasn't any teeth removed. You couldn't see any bodily fluids, which can trigger problems with YouTube. The surgery, the recovery was relatively easy. I mean, I'd had such horrible symptoms for so many years that this part actually was easy. And then the other challenges have been with the prosthetic aspect of going through this. And I think it's just partially because it's our mouth, it's our teeth, it's our face, it's our smile. So it's subjective and we care a lot about how that looks. And there have been issues with that aspect that I've had multiple times with a couple of different people going through this process. And so I feel like that's going to be more really getting clear on communication, because one of the biggest things all of this also taught me was how you have to advocate for yourself, whether it's all the research leading up to the decision of what I was doing, if I was getting the surgery and with who and where and what materials and what mindset with the biological dentistry or the Swiss biohealth dentistry versus conventional. In all my travels to Costa Rica to do this work, I've met so many people. I So many people getting conventional dentistry in Costa Rica as well, who are getting titanium implants and not having the IVs or just all the different things. There's more than one way to do things, and it's finding out what you resonate with, what feels right for you. And for me, as natural as possible was important. Removing the metals that could have been causing toxic issues was important. But then in the IVs, like they put dexamethasone and the antibiotic. The antibiotic in the IV is not their standard procedure. It's usually oral antibiotics. It's just that I was allergic to the type of oral antibiotics they were using. My initial plan had been to just have local anesthesia for my surgery. And my surgeon was very clear and pulled me aside and said, listen, you, one, you don't want to be awake for a multi-hour surgery, hearing all these things going on, even if you wouldn't be able to feel them because it's very stressful. And even hearing that, the drilling and the pulling and all the things that happen when they're taking out these root canals and putting in the implants and then separate from the whole sinus cyst and all these other things. He said it's it's very stressful for you to be conscious for that many hours during a surgery like that. The anesthesia is not the only thing you have to do in a dental surgery. You still need to do the injections of the local anesthetic, the lidocaine or novocaine or whatever the medication is. And you're talking the whole mouth. So then that's a lot of injections to make sure. And that what it's basically doing is it's making sure you don't bleed out, because those injections cause vasoconstriction, which means that you're not bleeding as much during the dental surgery because of those medications locally. So you don't have general anesthesia only with this kind of dental surgery. You have a sedation and you still have to have all the other injections. So, in fact, I think I remember them kind of waking me up to see how numb I was and what I could feel after they did it. So they put me under, they did all the injections, and then they took me slightly out of sedation to see if what I could feel, to know that I was ready for them to start doing the work, which that's a good thing because you want to make sure you're not feeling it. But I just recall, and I hadn't thought about it till just now, that going in, like my plan was as little medication as possible, as holistic as possible, all the things, but you learn as you go. And so certain things are done for a very specific reason. And so grateful that it all went so well. And I actually also was a little concerned about the anesthesia because I had had an allergic reaction to something similar to that years prior. But the anesthesiologist was right there, in the room, and they were able to make it work and it was fine. So, yeah. So I was put under, if you were just doing one or two implants, you can do local, but when you're doing 7 implants and removing 5 root canals plus the cysts and different things and working in the bone with the infection where the cavitations were. I mean, they have to go in, and once they suction out all the infection, then they have to debride and like cut out all of the dead bone. And I'm sure that doesn't sound pleasant. So I'm glad I don't remember any of that. Um, so I was just thinking about how interesting it is because you go in with a plan and then you learn. You get more information, you get educated on why certain things are really important. And again, I'm a healthcare provider, but I'm more holistic. But if you break a bone, you go and you have it fixed. So it's understanding that certain things are for a very good reason. And because of all the things, I never questioned or pushed back on having the dexamethasone or pain medicine in the IV on the day of the surgery and the day after to help with recovery because you want your body to be able to not be in horrible pain so it can find its equilibrium. And then, yes, I was as quickly as I could reducing pain medicine orally afterward. I think there was only one day I took 3 pills, um, maybe 2 on a couple of occasions, but I was really trying to do minimal of all of that. I did a lot of research going into the surgery. I had a consultation with Louisa Williams in Texas, who wrote a book on dental cavitations and did a lot of homeopathy. And then you'll see I have all of these homeopathic remedies and a laser and tons of supplements and detoxifying seaweed supplements and binders with chlorella, Chinese herbs, since I'm a Chinese herbalist and acupuncturist, to help with the infection. And so I did a lot of research about a ton of things and colostrum and all these things to help the immune system after they were taking the infection out because then now finally my body would be able to actually resolve this chronic infection. Whereas prior to having the infection taken out of those bones, where it was when it's necrotic, it's like also can be ischemic. So there's not blood flow and blood circulation because the bone around it is dead. And it's just a hole with all of this infection in it. So they're draining that out, cleaning and debriding that bone and getting it back to the margins of the live bone and then putting the membranes and the bone matrix in so your body can heal and replace that and fill in that bone. But then your lymphatics and your body, from opening that up, there's infection in the tissues in your mouth. And I had that swollen gland kind of thing for years and years prior to the surgery. So the recovery is a lot of detoxifying metals because in a cavitation, they say your body uses it as a dumpster. So in a dental cavitation, your body might be, um, putting bacteria or viruses or candida or um, different metals and infection. The recovery process, after the acute phase was really taking a lot of chlorella several times a day to bind to any metals that were being dumped from opening that up. years and years of just miscellaneous dental materials being in there, leaching various things into my body, I was, did a lot of research about, okay, how do we clean up the aftermath of this? And so helping strong immune support, binders to grab metals, and different herbs and things to help clean up things. So the surgery day was like this huge, amazing clean out of all of these things that had been silently pushing on my body for years and years and years. And I have to say, um, I felt like $1 million the day after surgery. I mean, in retrospect, also, I had an IV that morning, and it included painkillers, vitamin C, um, antibiotic. I'm not sure if there was anti-inflammatory in that day as well. But I wasn't feeling pain that day, but I felt so much more energy because I had been so tired for so many years just fighting all this stuff that I think my body was just like, hooray, we're free. So taking that load off of my immune system by having the surgery remove all of that infection was just life changing. And also, I went from wearing sunglasses in the house and having a really hard time outside with, wearing visors and sunglasses all the time and still being sensitive to light. That was one of the hugest shifts, was that I wasn't as light sensitive, which was amazing. And um, so that next day, I was just buzzing with joy and gratitude. And my body was really like, wow, that was great. Um, and then the recovery process started, which is normal. And all in all, like I said, you'll see it unfold, but it wasn't that bad at all. So it's definitely, I I would say probably more than the average bear. I'm prepared. I was prepared. I did all the things. Um, for at least a month before, maybe 6 weeks before surgery. I was eating more Weston A. Price diet to prepare my bones and my body. So lots of slow cooked meats on bones to get collagen and all of the nutrients my body would need to actually rebuild all the bone. So I shored myself up prior to that and was taking all the supplements from, um, at the time, the Swiss Biohealth Immune Basics, AM and PM, but I made my own version. Like, I had their list and I just bought all the things and then some, and was taking a boatload of supplements constantly for about a year. I've been, because after the surgery, then the bone had to grow. So it was a lot of commitment to, once did my research and learned what the the different complications could be and what the implications of those diagnoses were, and how do I give my body what it needs to have the best chance to fully recover. And then mentally, emotionally, it's a whole other thing, because how can we get our belief system out of the tangle of what we had experienced with kind of more of a chronic illness for many years. So that's been an unfolding for a while for me to really be, how do I get complete with, like, my body is a miracle and it doesn't need to stay in any form or condition of illness anymore, and look at it more of a life experience and this, growth of kind of taking my power back from having these things. And it's like nobody's fault, but to, in an empowered way, educate myself, prepare myself and make a decision so that I could move on with my life without having these dental issues being an issue. I just hope that this is inspiring and helpful and gives some ideas for anyone who might be navigating this to really, you got to trust your gut. You have to do your research. Don't just believe anything anyone says, not me or anyone else. I tell all my patients that. It's like, don't give your power away. I'm not your authority. Your inner authority knows what's best for you. But we really have to advocate and look deeper into things because there's a lot of benefit that the body can get through food and supplementation. And like, I never thought I would be a huge IV advocate. However, I am, because I did the 11 days in a row in Costa Rica. And then because of the infection, my doctor wrote uh, a letter and recommended that when I returned to the States that I get another week or so of high dose vitamin C. I had to jump through some hoops, had to have a blood test to show that I was able to metabolize the vitamin C, which I knew because I felt really good getting those IVs. And I did 8 days, and there's IV clinics all over the place now. A lot of people will just go have the procedure, whatever the dental office or surgeon is offering, but not do any additional follow-up or any supplement prep or follow-up. I was the opposite, but I'm a healthcare provider. I've been, you know, doing this for everyone else and myself for almost 20 years now. So my approach to if I'm doing this all-in-one surgery and it's all cash and there's no insurance coverage and I'm, doing this to get myself feeling well, I'm going to do the research and set up everything I possibly can for the best outcome. So here is the section where viewer discretion is advised if you're sensitive to anything visual, but I don't have anything extreme in here. So we're going to look at my CT scan prior to the surgery. You can see I had a little titanium implant and lots of crowns and that missing tooth and root canals on those teeth. And then we'll see how my actual teeth looked prior to the surgery. And it's coming up if you are sensitive. It's a picture of my face actually during the surgery with the mouth propped open. So they really hold your face open with these devices to get in there. But this is prior to them doing any of the work. I'm trying to keep it not too graphic, but still let you know what happens. And now we're going to get into, those are pieces of the root canals that were removed that my surgeon gave me after the fact. And then I have some close-ups of the pieces of teeth. And you'll see some of them have these black things, or there's some green and orange material. That black thing is one of the things that was touching some of the nerves in my jaw, and you can see those in some of these little particles. They basically get all broken up as they have to pull them out. And then this was taken a while ago, so they're dry and they're in this little container. So there's little pieces of the teeth with the root canal portions that can be darker or orange or green, depending on the materials. And then those parts of the top of the crown. Yeah, there's a good example of one. That's the things. Now, this is right after the surgery. I made it black and white, so it wouldn't be as graphic, but that was a piece showing the tooth with those little things sticking out. Now, this is the CT scan of my final implants from this first surgery. So 7 implants. So 3 quadrants, had no molars. And there's me right after surgery with the ice pack on in the chairs in the waiting room. And then that was after I got home and I was trying to eat this ice smoothie with some berries. It was a big day, and I'm so grateful that I made the choice to do that.